labor is unique. Many factors come into play that affect how this journey unfolds and how long it lasts. In fact, the total length of labor can vary widely, from as little as 6 hours to 24 hours or more. Labor is usually longer for first-time moms and shorter for second-time moms. While average lengths for the different stages are provided in this program, keep in mind that the length of your labor may be quite different.
It's probably about 24 hours worth of fun when you look at it all. Like when you look back, you're like, oh, that's about a day worth of fun.
The first stage of labor, when the cervix dilates completely, is usually the longest, lasting an average of 14 hours for first-time moms and 8 hours for second-time moms. The first stage is further divided into 3 phases: early labor, active labor, and transition. These phases blend together as part of a whole experience, and moms may not always be aware that they are passing from one phase to the next. During first stage early labor, the upper part of the uterus contracts. This causes the cervix, the bottom of the uterus, to start to efface, meaning to thin out. The contractions also cause the cervix to start to dilate, meaning to open. In early labor, the cervix dilates to about 3 centimeters.
And we say more like 4 to 5 now. We're more comfortable with like moving to 4 to 5.
Contractions during early labor may last only 30 to 45 seconds. The time between contractions is measured from the beginning of one contraction to the beginning of the next.
And this can really be spaced out.
In early labor, contractions occur at irregular intervals, varying from 5 to 30 minutes apart, and slowly become more regular as early labor progresses.
Like you have like 5 minutes, 5 minutes, 30 minutes, 15 minutes.
If you're awakened during the night by early labor contractions, it's a good idea to try to go back to sleep.
Well, for early labor, in the beginning, I was trying to continue resting and sleeping, and once I realized that was not going to work for me, I came downstairs and I started sitting on a birthing ball.
This early phase typically lasts 6 to 12 hours for first-time moms. Since this is usually the longest phase of the first stage, women often feel more comfortable during early labor if they stay at home. It's also important to eat, drink, and rest as much as possible to prepare for the challenges of active labor ahead.
You don't have to go rush immediately to the hospital. Just call your doctor if you're concerned.
If it's hard to rest, it may help to change positions and continue light activity.
Walking for me was really nice. It was dawn, the sun was just starting to come up. It was still kind of gray, and it was very peaceful and quiet. It just felt like a really calm and natural way to start the whole process.
The stages of labor are marked by more than physical changes. A woman also experiences a range of emotions. During early labor, many women feel relieved and excited because the births of their babies are near. Partners and support people play a large role in helping moms stay comfortable during the different stages of labor.
During the early labor, I was just overwhelmed with all kind of emotions and everything, and I just really wanted to offer all my support and just be there for her and just encourage her.
In early labor, support people can help mom rest and relax, take a walk with her, and involve her in books, card games, or other light activities.
We went to the nursery and looked at all the newborns, and we were going to be the parents of the child, so we were just excited.
And remember, active labor, this one she goes more inside. She's not looking at the nursery anymore. She's more focusing on herself.
A change in the intensity and regularity of contractions signals to the mother that she is progressing to first stage active labor. First stage active labor lasts an average of 3 to 5 hours. Remember, this is only an average, and having a shorter or longer active phase is perfectly normal. Contractions during active labor last 45 to 60 seconds each and are 3 to 5 minutes apart. Women are usually advised to come to the hospital or birthing center when their contractions are 5 minutes apart, but always call your caregiver and follow his or her instructions on when to go to the hospital. During active labor, the upper uterus continues to contract. With each contraction, this upper portion grows thicker and stronger. These more intense and frequent contractions cause the cervix to dilate at a faster rate and may cause spots of blood called show. During this active phase, the cervix dilates from 3 to 7 centimeters. When women arrive at the hospital or birthing center, the nurse or primary care provider will likely assess dilation by doing a vaginal exam. If the bag of waters did not break at the onset of labor, it may break any time from active labor through pushing due to the force of contractions.
It's really important to me when I was in active labor and really dealing with those contractions that people were staying quiet, because it was really hard for me to focus when there was noise outside of just my little bubble. But having Aaron's voice in my ear counting and telling me I could do it really helps to bring me back to center.
Emotionally, women in this active phase begin to concentrate more seriously on their labor. They may also be more dependent on others and experience wavering self-confidence. Support persons can help by providing words of encouragement, assisting her in changing positions often, and using the relaxation and pain management techniques that work best for her. Also, make sure the labor room is quiet and comfortable and help her rest in between contractions.
I think it wasn't until very late in active labor that I started feeling a little bit unraveled, and definitely not doing anywhere near as much work as Beck was, but just feeling very, very worn out and a little bit helpless too. I think that, you know, as supportive as you can try and be, that ultimately there's nothing you can do to make the contraction pass quicker or anything like that.
As first stage active labor progresses, the baby starts a process called internal rotation. In order to fit through the bottom of the pelvis and into the birth canal, the baby's head needs to turn and face the mother's back. This is called the anterior position. In some births, the baby's head turns to the posterior position, which means she faces the front of the pelvis. If this happens, her head puts added pressure on the mother's back, which may cause painful back labor and slower progress. Due to the force of contractions, the shape of the pelvis, and the use of productive labor positions, a posterior baby may turn on her own to the anterior position prior to birth. The third and final phase of first stage labor is called transition. Transition is considered the most intense part of labor, but also the shortest, usually lasting between 30 minutes and 2 hours.
During the transition stage, I couldn't get comfortable. The nurse told me to try some moaning. You take a deep breath in and then you go, you just relax.
Contractions during transition intensify quickly and have 2 or more peaks. They last 60 to 90 seconds each, and they are 1 to 3 minutes apart, allowing moms very little rest in between. During transition, the forceful contractions cause the top of the uterus to grow thick and strong enough to push the baby down. Contractions also cause the cervix to dilate completely, from 7 to 10 centimeters. Due to the intensity of transition, it is not uncommon for women to experience hot flashes, chills, shaking, nausea, or vomiting. Because of these challenges, a woman in transition often feels irritable, disoriented, and increasingly dependent on others.
Emotionally, I felt completely drained during the transition phase. And I knew that I was heading toward the end, but I didn't feel like I had much left to give. But I knew I had to just keep working through it and keep breathing and keep plugging along.
Partners and helpers can assist mom in focusing during contractions by using direct eye contact and short, to-the-point directions. They can also encourage her to rest in between contractions and give her extra emotional support to keep her from getting discouraged during this intense period. It may help to remind her that each contraction brings her closer to the birth of her baby.
During her transition phase of labor, the pain got more intense for her, so I was massaging her lower back more, and not so much massaging, just a solid pressure. Just stand there and give her more support, tell her she's doing a great job, tell her, you know, she's gonna get through it, it'll all be over soon.
All right. Any questions?